Hi there, I am Dr. Camacho, an ear, nose, and throat surgeon. In this video, I will talk to you about peritonsillar abscesses. Here we can see an infection in the back of the throat of a patient who has a peritonsillar abscess. If we look at their infection, you can see that there's a pus pocket deep to the surface of the tissue. The way this happens is that a patient will develop tonsillitis, which is an infection of the tonsils, as you can see here. And classically, these infections will spread via a pocket in the tonsil called the crypta magna. It then goes through what's called the capsule, and there's a space between the capsule and the superior constrictor muscle, which is on the side there. And the pus can collect in that space. Additionally, the way patients will present is you'll have a deviation of the uvula, meaning it's moved to one side. You may have significant swelling on one side. It can be very difficult for patients to open their mouths, called trismus, because the muscles, the pterygoid muscles in the back of the throat get involved and it's difficult for the patient to open their mouth. Additionally, they can have drooling, hot potato voice, fever, swollen lymph nodes, severe pain, and the infection that causes this is usually Streptococcus bacteria or Staphylococcus bacteria. Often the patients have failed medical therapy. This infection can then spread down the throat. It can go to the side, make a bigger pocket, and the feared complications that we have is that the infection spreads either to the back of the throat or down the neck into the chest. Here I show an arrow with the pus pocket shown. It has a darker center and the outside has what's called rim enhancement. And this is the area that we are going to try to target with our surgical procedures. The first step is to spray the back of the throat to help numb the patient's throat so that they don't feel the surgical treatment as much. Once we spray, we will typically then inject local anesthetic onto the surface, especially the mucosa, this pink part of the tissue here. We then will treat with one of two options, either place a needle into the pus pocket and aspirate to help decompress, and often we will do multiple spots if that's what we choose to do. The other option is to make an incision in the back of the throat, and in this incision we will usually make a smaller cut, enough for an instrument to go in there to spread, and we don't usually go very deep. We just go over the surface of the tissue. Once we have made that incision, then we can use this tool to go into the pocket and spread. Once we do that, the pus can then come out, and once the pus comes out, you can see that the tonsil and the peritonsillar area start to move and decompress. After the surgery or procedure, the patient then goes home with oral antibiotics. Sometimes if it was a severe case and the patient had significant swelling, we may choose to admit them to the hospital overnight for antibiotics. We may see the patients back in the clinic after a few days or a week, just depending on how bad the infection was prior to the treatment. We may or may not have sent the cultures for evaluation. If we sent cultures, then when the patient comes back to see us, we might tailor their antibiotics to the cultures, depending on whether they're getting better or not. If you or someone you know has a peritonsillar abscess, you need to make sure you see a healthcare professional. Do not try any of these procedures at home. It's very dangerous to do so. And if you have any questions, please talk to your healthcare provider and they can answer them for you. I am Dr. Camacho. Thank you. Bye.